So, good evening, everybody. It's a pleasure to be able to speak to this meeting, and I've been asked to speak on realistic solutions, the international perspective on climate change and health. And the first thing I'd like to say is it's a pleasure to speak to a group based in Glasgow, as you're about to host what we think is effectively the most important public health conference to take place this year, or probably for the last 5 years or so. And the reason for that is that we at WHO do consider the Paris Agreement and therefore the climate change negotiations, which are now being hosted, about to be hosted in Glasgow, as potentially the most important public health agreement and therefore negotiations of this century. And I think by now the reasons for that are reasonably obvious. The effect that climate change is having on all of the environmental and social systems that maintain our health is already so fundamental and is going to be even more fundamental out into future decades. That unless we properly address the climate crisis, then we are undermining the foundations of good health to such an extent that everything that we do in the health profession is likely to be overrun by all of the damage that we're doing to the systems that sustain that. So the discussions that are happening in Glasgow over the next week or so, we do think are absolutely critical to the future of health for the world. And what I wanted to quickly do is to quickly run through the main objectives that we see, the main tasks that we see that we have as public health professionals, as a profession and as a society, in order to take this opportunity to address the climate crisis so as to protect health and actually to get really big health benefits while doing so. And so the first and most immediate task that we see for global public health is protecting people's health from the risks and the threats that climate change is already throwing at us. And of course, the big challenge with climate change, different to something like COVID, terrible though COVID is that for COVID, we now know the public health interventions which are effective in controlling that individual disease. And we know that if we can roll them out across enough of the world's population, then we will completely get on top of that disease. Climate change is not like that. So climate change increases the frequency and intensity of extreme weather events. It makes it easier to transmit infectious diseases such as malaria, dengue, or cholera. And it also does such fundamental damage to the environmental systems which maintain good health, and it has such dramatic effects over the longer term that we have challenges such as sea level rise, which will submerge coastal areas and will in fact submerge whole nations over time unless we get carbon emissions down. And it should be obvious that it will be impossible for us to protect the health of those populations if we're in fact submerging their countries. So that's the scale of the challenge that we have. And we're also seeing this reported back to us from countries themselves. We carry out a global survey. We support countries to carry out assessments of the health challenges of climate change. And on the slide on the right-hand side, you can see the ones that they're listing back to us that they're encountering in their own countries. And they include ones which we're expecting, but they also include emerging issues such as mental health impacts, particularly amongst younger people, that we were hardly dealing with before. So that's task number one as we see it. The next task is to play our part as global health in driving down the carbon emissions which are driving the climate crisis. And as you can see on the slide, it is now very clear, and much of the negotiations that will happen in Glasgow and the COP are about the extent to what the world has to do to get off our currently unsustainable path of carbon emissions, which will be driving us, the latest estimates are to a warming of over 2.5 degrees centigrade, to get us on a path that would actually meet the Paris targets of keeping global warming below 2 degrees centigrade and ideally below 1.5 degrees centigrade, which was what we need to protect those most vulnerable countries and populations. So we know we have to cut carbon emissions fast. We know we have to do it quickly. And we see one of the big challenges and opportunities for global public health is to support that drive through our advocacy, but also to give the guidance that will help countries to do that in such a way that we would actually get massive public health gains. And so just a couple of examples of that. We know now that air pollution around the world kills over 7 million people each year. That's about 13 people a minute. And about 2/3 of outdoor air pollution, at least, comes from the burning of fossil fuels, so the same things which are driving the climate crisis. We also know that around the world we have a massive problem of unhealthy, unsustainable diets, which has a similar magnitude of impact on global health. And if we are able to put into place measures that make the transition to clean energy systems or healthy and sustainable diets and so on, we can help to support this drive to cut carbon emissions, but also have a real step change in the health of populations. And we think that's one of the most positive things that the health community can bring to the discussions around climate change. And just quickly on where countries are in terms of meeting those challenges. So we see that in terms of adaptation and resilience, so protect that first challenge of protecting people's health from the impacts of climate change, we do actually see quite a lot of progress now. So about half of all countries now have a health adaptation plan for climate change. And that wouldn't have been the case about 10 years ago. Very few countries would have had those plans. The challenge that we have on that side is that the finance is not in place to support particularly those low and middle income countries. So there is now international climate finance. That's one of the other things that is being discussed in Glasgow. The target is to mobilize about $100 billion a year to support the most vulnerable countries to protect them from the impacts of climate change in general. The challenge at the moment is that almost none of that goes to protecting global public health. It's only about 0.5% of that finance goes into health projects. So that's the problem we have there. On the other side, we do on the objective of driving down carbon emissions and also getting those health co-benefits of climate change mitigation. We are seeing that in the commitments that countries are now making to the Paris Agreement and that they are renewing for the Glasgow COP, we do now see quite a large number of those, a majority of those, do make that connection between climate change and health. So that's a very positive thing. However, up until recently, very few of those countries were actually assessing the health gains that they would get from the climate commitments that they are making. And this ends up with a very, I would say, unbalanced conversation about what we need to do to address climate change, where the conversation talks about the need to protect the climate to cut carbon emissions and balances that against the costs that it will take to put in place clean energy, sustainable transport systems and so on. But at the moment, countries are not articulating all of those health gains that they would get, which in many cases, the health gains alone, just for example, from improved air quality, would actually cover the cost of mitigation. So we think that the conversation is missing a really good positive opportunity to talk about the health gains that we will get from addressing the climate crisis. And we want to see more countries assess those health gains and include them in their climate commitments. And our review of the latest round, which is now coming forward for the Glasgow COP, is that more and more countries are now starting to do that. So in terms of the solutions and the practical actions that we can take in order to address these challenges, to take the first one of protecting people's health from those risks that climate change is already throwing at us, what we have found in working with particularly developing countries over the last 10 years or so is that the way to address this is not to try and reinvent a whole new system to deal with climate change and health specifically, or individual climate risks and health specifically, but to look at the system as a whole, to look at the core functions of health systems that most health systems people will recognize around leadership and governance, health workforce, information systems, interventions, and so on, and to build climate resilience around that. And we've published an operational framework for building climate resilient health systems, and we're finding that to be very successful in terms of engaging with ministries of health and with the health community in countries, so that they can see that we're not trying to distract them with a whole new agenda, but just to strengthen those parts of the system that need to be strengthened because of the increased impacts of climate change. And we also see that there are practical things that we can do to support countries with that really basic challenge now of getting in the finance to address the health impacts of climate change. Because I would say that for the most part, in most countries, we're now at a stage where they understand the risks, they see that it's mainly an exacerbation of existing problems, they have the technical guidance to support them, but they simply don't have the money to put into place those measures. And so we are working with countries, asking them what the problem is with accessing climate finance, and then supporting them in order to do that, to address facilities such as the Green Climate Fund or the Global Environmental Facility, which should be providing the finance to protect people's health from the impacts of climate change in the same way that they're trying to protect natural ecosystems, food systems, water resources, and so on. And to sort of sum up the agenda as we see it in terms of solutions for health and climate change, we launched a report just about a week and a half ago, I think, which is our contribution to the discussions which are happening in Glasgow. And we've termed this the health argument for climate action, because this is all about not just describing the health risks from climate change, but articulating the range of things that should be done and that can be done in order not only to protect people's health from those risks, but also to gain those big health co-benefits that I was describing. And so some of these are quite sort of fundamental things that we have to do. So commit to a healthy recovery from COVID-19, because we see that much of the economic investment that is going into resuscitate economies after the impacts of COVID is going into things which actually increase carbon emissions rather than decrease carbon emissions. To make clear that health is a human right, it's right at the beginning of the Paris Agreement, so everything we do should be protecting people's health from the risks of climate change, and not as something that can be negotiated, but as something that needs to be the basis of, and everything flows from that. And then a whole series of recommendations which are around harnessing the health benefits of climate action. So that includes increasing resilience to climate risks, as I've just described, but we make a whole series of recommendations around supporting energy systems, for example, that protect and improve climate and health. So particularly around putting into place those measures which will bring those improvements in air quality that will save so many lives. We make recommendations around improving urban environments, transport and mobility, so to basically reduce private car use, to prioritise public transport, active transport, walking and cycling and so on. It includes protecting nature as the ultimate foundation of our health, and a series of recommendations around quite a neglected issue, we think, which is around healthy, sustainable and resilient food systems, where we think the health gains from the same things that we need to do to reduce carbon emissions could have even greater health benefits than what we would expect from air quality. And the latest evidence is that we could save probably over 5 million lives a year from putting into place food systems that would be compliant with the Paris Agreement, but would also prioritise health. And then the final suggestions are around financing a healthier, fairer and greener future, which is addressing those barriers to the health community accessing climate finance, but also changing a series of perverse incentives, which means that effectively we are massively subsidising fossil fuel consumption. The International Monetary Fund estimates that we provide an effective subsidy of about $5.9 trillion a year to fossil fuel consumption, either in financial subsidies or the uncompensated cost of health impacts, particularly from air pollution. And then the final recommendation is on listening to the health community and prescribing urgent climate action, because we think that health voices have a really big role to play in making the argument for positive action on climate change. And just very quickly to say that we do see things changing now within the climate negotiations. So the COP, which is happening in Glasgow, will have the strongest health programme that we have ever seen in a COP. It's the first time there's really a formal health programme. And there is a series of initiatives around encouraging countries to commit to building climate resilient health systems, to follow the model which is now coming out through the NHS in the UK of committing to reach net zero carbon emissions from health services themselves, because health services now contribute somewhere between 4 to 5% of global carbon emissions, to encourage countries to make climate commitments, nationally determined contributions, which prioritise those health gains. And then the final and probably most important one is, over the long term, is on mobilising health voices for climate action, because we do see the health community stepping up and speaking out on this issue. And it's now, I think, quite widely recognised that they can have a really positive effect on the conversation. From WHO, we are providing direct support to countries to build climate resilient health systems. We're supporting them to carry out assessments. We're supporting them to carry out, to develop health adaptation plans. And we're also supporting them to access climate finance, which is now the big barrier. In the middle weekend of COP, we will be working to try and put this on the global stage. We will have a dedicated conference on health and climate change, run in partnership with the partners you can see on the bottom, including Glasgow Caledonian University, who will be the physical host of this meeting. And I'd like to encourage you to sign up to join that conference. I'm not sure whether we still have in-person spaces, but we certainly do. It is possible to join online, and the programme is designed to be a hybrid programme, which should be spending a whole day articulating this positive agenda of health and climate action. And then the final message which I really wanted to emphasise to this community is the extent to which health voices can serve as positive advocates for climate change. And so the figure that is shown at the moment is a figure of trust in professions, polling in this case from the UK from a couple of years ago. And hopefully you can see that on the left-hand side, the most trusted professions, I would say it's doctors. In fact, it's not doctors. The only thing that beats doctors is nurses. So there really is a positive role for the health community to speak out on the climate issue, because their voices are considered impartial on the climate issue. It's not doctors and nurses arguing for better conditions for doctors and nurses. It's them speaking up on the big issue of our time, which is, can we preserve a planet which will preserve and protect the health of current generations and future generations. And just a final example of that, the report that I referred to earlier, we had that signed by our Director General, Dr. Tedros. He also signed a sign-up letter which has been signed by organisations representing over 45 million healthcare professionals, and we've hand-delivered that by bike from Geneva to London, where I've handed that over to a team of healthcare professionals from around the UK who are cycling as we speak, or hopefully they're resting now for the evening, from London to Glasgow to deliver that message to the COP. And we think that's the kind of engagement showing the commitment of the health community, which is the most positive thing that we can do to support and drive change. So with that, I'll close, say thank you, and look forward to the discussion.